Today, women are living 30 to 40% of their life after the age of 50. This can also be a time when health starts to deteriorate and many diseases such as cardiovascular disease, osteoporosis, diabetes, and autoimmune diseases may develop. No one prepares us for our own midlife experience. Hi, my name is Dr. Barbara Johnson, and I founded the Johnson Center for Health and established a healthcare program for women called Age Elegantly. I did this for two reasons. First, women are not little men and require a health program that acknowledges their unique hormonal and biochemical makeup. While important, a woman's health is more than just a pap smear and mammogram. So in order to age healthy and avoid or reverse health issues, women need a program that is focused solely on their needs. Unfortunately, the healthcare system for decades has been male-dominated, meaning that most of the studies that we use to establish therapeutic protocols exclude women. One reason is the concern over potential risks to women of childbearing age and the potential effects on fetal development. Another reason is the fear of hormonal variations during the menstrual cycle, which might complicate study results. While females are now being included in more studies, the FDA still acknowledges this disparity and that huge gaps exist in studies on cardiovascular disease, cancer, and psychiatric disorders. This is so very important and may explain why women are 75% more likely to experience an adverse reaction to medications. Did you know that a 2022 study revealed that this difference was not just due to the lower body weight, but many other factors that highlight women are not little men? The consensus from the study was the following. Most biomedical research has been conducted on males. So far, we have been led to believe that any results also apply to females, and as quoted in the research, it is said that we know men and women experience disease differently, including how disease develops, the length and severity of symptoms, and effectiveness of treatment options. Here are a few facts that should not be ignored. Women are 80% more likely to get an autoimmune disease. 2/3 of all Alzheimer's and dementia cases are women. Women have 10 times higher rates of Hashimoto's thyroiditis, and women are twice as likely to be diagnosed with anxiety and depression. 80% of osteoporosis are women, and women make up 60% of all IBS patients. Age Elegantly is about total health, prevention of heart disease, Alzheimer's disease and dementia, chronic conditions, osteoporosis, gut health, muscle loss, and many others. I have to say it again, women are not little men and need a program specifically geared toward our unique physiology. The second reason I developed Age Elegantly was to help women navigate the years leading up to menopause and the years after. No one prepares us for menopause, and so many women hit the age of 50 and their whole life changes. Not only do women become someone they don't even know or like, but the term menopause has so many negative connotations. Menopause is actually a dividing line that is established by society and such a defining point in a woman's life. Before menopause, women are seen as young and vibrant, but after menopause, women are dismissed as old, unhealthy, and unproductive. Changing how we view menopause is extremely important because this is the new biological state for the rest of your life. All menopause really means is that we no longer produce enough estrogen to be fertile. We can no longer get pregnant, and that's it. It doesn't mean we are old. Viewing menopause as a new era of freedom can be so empowering. But unfortunately, many women do feel old at menopause because the hormonal shift, which causes fatigue, brain fog, weight gain, gut issues, joint pain, and new health concerns such as hypertension and elevated cholesterol. And almost all of these symptoms are due to the loss of hormones, estrogen and progesterone. They affect almost every system in our brain and body, and when these hormones drop, things can go absolutely crazy, and women feel lost and unheard. But we are not meant to completely wipe out our hormones at menopause. Our ovaries will stop producing estrogen and progesterone. we will stop menstruating, but we have a built-in backup plan that should provide us with enough of our hormones to remain healthy and energetic. Once our ovaries stop producing our hormones, our adrenals should provide what we need for the second half of our life. The reality is that everyone's backup plan is failing due to chronic stress. Stress keeps our adrenals pumping out cortisol at the expense of our sex hormones. This is why it is so critical to understand the importance of reducing stress in your 20s and 30s to preserve your backup system. Stress is both physiological and psychological and contributes to the development of almost all chronic diseases and hormonal imbalance starting at such a young age. PMS, PMDD, irregular and heavy periods, anxiety, depression are so common in young women these days. Age Elegantly is a woman's wellness program that promotes health and longevity by understanding the unique biochemistry and needs of women. Our main focus is a unique rebalancing therapy that brings the body back into homeostasis. It is this homeostasis or steady state that maintains our body's own healing capacity. Within all of us is an intrinsic healing potential that is far and away the most powerful medical tool that we possess. But our metabolic reserves wear away as we age due to the daily decisions and lifestyle choices that push our stress capacity and overwhelm our system. Rebalancing therapy works in a set of steps, similar to a relay race, that helps us feel and perform our best. When these signals are clear and in balance, our bodies work smoothly and we're at our best health. It's important to remember that your life after 50 can be some of the best years when you take your experience, wisdom, and visions into the world to pursue your passions. To enjoy these years to the fullest, it's important to build a foundation for long-term metabolic hormone balance. This can be done whether you're in your 30s or 70s, but by taking care of yourself now, you can help prevent unnecessary health problems and age gracefully and age elegantly. See, I imagine a world where women embrace aging as a time to rediscover their potential personally and professionally, where women are prepared for menopause and do not suffer from feeling mentally and physically broken and fear that their life is lost. I see a world where one wakes up in the morning feeling refreshed and exciting to jump into your day, where women over 50 are respected for their wisdom, grace, and contribution to the world, and understand that aging does not mean loss of health and vitality, but just the opposite. My goal is to empower women to have total clarity about what's most important with the energy, motivation, and focus to accomplish it. See, when I trained as a general and trauma surgeon over 2 decades ago, I had no idea that my focus today would be to help women age elegantly with a functional medicine approach. But my transition to this work is a personal story that started in 2004 when I was 45 and diagnosed with multiple sclerosis. At the time, my life was very stressful with 2 small children and being on call every second or third night as a surgeon. My body just shut down, and I developed neurological symptoms which were diagnosed as MS. I was overall healthy, except for my stressful life, and completely surprised and devastated by this diagnosis. I tried to explain to the neurologist that this was all stress-induced, but he refused to believe, and I felt like my concerns were not acknowledged. I felt abandoned by the medical system. I wanted to know why this happened, not just take medication. I started to research the causes of MS and discovered Dr. Terry Walls, an internist who also battled with MS. She was able to completely reverse her symptoms by going back to the biochemistry to discover the possible cause. By following her example, I made significant changes in my life and completely reversed all symptoms, and I am still symptom-free 19 years later without taking any medications. It was my discovery of functional, integrative, and cellular medicine that opened my eyes to a new way of treatment. I also added nutrition, stress reduction, and lifestyle factors to my toolbox and switched my focus from surgery to helping women understand that disease is not random and doesn't just happen. It is influenced by a web of circumstances, experience, and lifestyle factors. Adding these modalities to my traditional medical education allows me to fully care for women during this vulnerable time to rebalance their metabolic health. I am dedicated to spreading the word to help other women understand that it is not okay to accept symptoms as normal aging. Symptoms are a sign of an underlying imbalance and metabolic dysfunction and not an inevitable aspect of aging. You do have control over your health and the power to heal your mind, brain, and body to be physically, mentally, and emotionally optimal. An incredible quality of life is still within your reach. Rebalancing therapy is for you if menopause scares you and you've seen your friends go through the change and it wasn't pretty. This is for you if beloved female members are losing their battle with dementia and you are determined not to follow that same fate. This is for you if you avoid looking in the mirror because the body staring back at you is one that you do not recognize. This is for you if you feel mentally and physically exhausted day after day and it's harder to get up in the morning because of aching joints or muscles. This is for you if you are confused about diet and exercise and feel like none are working for you. This is for you if you have difficulty going to sleep because your brain won't quiet down and then you're waking up again at 3 a.m. This is for you if you feel like your relationships and marriage are suffering because of irritability, mood swings, and fatigue. This is for you if you feel like you've lost your joy of life and just trudge through the day, or you feel like you're losing your edge in the boardroom and finding it difficult to keep up with work that you love. Finally, this is for you if you know there is more to life than just surviving, and you are feeling trapped and frustrated with your life. You know, it's possible to feel energetic, empowered, and the best version of yourself, both mentally and physically. It's possible to understand your body and what you need to maintain your optimal health. It's also possible to realign with your purpose in life rather than just trying to get through the day and create a life that is fulfilling and one that you choose. When I take patients through the Age Elegantly method, it is a results-driven and evidence-based holistic treatment to bring balance in both mind and body. The Age Elegantly method sets you free from the debilitating cycle of inflammation, obesity, pain, and disease. This method removes physical, emotional, and environmental toxins, rebuild at a cellular level so your biological systems function in harmony, and then restores the foundations of health to move into optimal wellness well into your 90s. So let me tell you a story about one of our patients. Elizabeth is a 53-year-old attorney who loves her work as a prosecutor but found it hard to keep up. Her work requires focus, energy, and being at the top of her game, but she struggled to keep up with the work and started to feel really insecure when in the courtroom. Her main concerns were exhaustion, brain fog, memory, slow thinking, bloating, indigestion, difficulty sleeping, and an expanding waistline. She was also emotionally on a roller coaster and concerned about her marriage. She had been to multiple physicians knowing that something was wrong, but all her lab work was normal except for a slightly high cholesterol and blood pressure. She was given prescriptions for sleep, depression, and advice to cut down on her fat and to exercise more. She was also counseled that maybe she should just consider taking some time off from work or slow down. But Elizabeth did not want to stop working. But she felt that she could not continue to represent her clients with the way that she was feeling. A friend told Elizabeth about the Age Elegantly program, so she set up an appointment. And working with the help of my team of practitioners and health coaches, she completed the comprehensive testing and metabolic analysis. I don't really want to get too technical here, but I look at tests that aren't commonly ordered. In Elizabeth's case, she was very low in nutrients with a metabolic dysfunction and elevated blood sugar. Her oxidative stress markers were high and her detoxification pathways were impaired. Her estrogen and progesterone were out of balance and her cortisol was very high. So I started Elizabeth on a 6 to 8 month program to balance the hormones, reduce stress, replenish her nutrients, eradicate GI pathogens, and remove inflammatory foods. After 3 weeks, Elizabeth noted an increase in her energy and a decrease in brain fog. After 3 months, she was starting to feel like herself again and confident that she could represent her clients well. After 6 months, she had lost 35 pounds, was sleeping through the night, and feeling like for the first time in many years, she was able to focus and take on the company's high-powered clients. Now let me introduce you to the 5-step Age Elegantly method. The first step being acknowledge to be proactive. This most important step is to start before you have any symptoms. By giving the edge to your symptoms, you can have a game plan on how to manage them as they may arise. Here's the truth. Your ovaries will stop producing and no woman avoids menopause. My job is to help you prepare, reduce and resolve the symptoms as they creep in. I call this your midlife check. Many patients we see at the clinic are in their late 30s and early to mid 40s. They know something is off because of anxiety, depression, irritability, and weight gain, but are confused about why this is happening. And they are frustrated when they are not getting answers from their primary care doctors. They don't realize that they are in perimenopause because their menstrual cycles are regular. To use a surfing analogy, the first step in the Age Elegantly method is to acknowledge that the wave is beginning to crest, and I'd rather teach you how to easily surf through it rather than get pounded on the sand with no energy to get back in the water. Right after the consultation, step 2 in the Age Elegantly method is to meet again to discuss your lab results and to create a comprehensive picture of your health. We evaluate results and develop a proactive aging protocol. We take a whole body approach and replenish with nutrients, thyroid or adrenal support outside of estrogen and progesterone unless needed. In step 3, we implement and optimize lifestyle and nutrition routines. We often change nutrition because most women aren't eating enough, especially in the mornings. We also address if women are nutrient depleted and aren't able to absorb nutrients like vitamin D, B12, omega-3s. It's important to metabolize fatty acids in the microbiome with digestive enzymes. We prescribe supplements based on your unique biomarkers. We round out the steps 4 and 5 with a nurturing follow-up support call to adjust any protocols if necessary, and with gratitude by congratulating yourself for preparing your body for the next big life transition. We covered a lot today, and I know you may still have some questions on how this pertains to you and your Age Elegantly journey. I want to honor you for taking the time to watch this Fastclass today, and I've created an opportunity for you to talk with one of my health coaches to see if this approach to women's wellness is for you. So click on the calendar link below to reserve your complimentary discovery call. If you feel like you have hit a dead end in seeking help because your doctor's not listening to your concerns, or if you're exercising like crazy, barely eating any food, yet continuing to gain weight, then you may want to talk to us. If you are always saying, I used to fit in those jeans, I used to sleep well, I used to have great energy, I used to be mentally sharp, but now I'm moody and so tired that I just want to sit on the couch and binge Netflix, then let's talk. Do you lie in bed in the morning dreading to get up? Do you avoid looking in the mirror? Do you feel like you may need to retire from your career because your brain isn't functioning as well? If that's the case, let us help you. We promise that you will have a better idea of why you've been struggling with underlying health issues and how to begin the journey of optimal health. You will finally understand why what you're doing isn't working and get clear on the next best steps to take. And finally, we will assess your current situation and determine what you need most and where you want to go so you too can age elegantly.